morning, everyone. Today, I am Dr. Somnath Chatterjee. Today, our discussion is understanding of hypertension. Our today discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps into blood. It pumps blood into blood vessels. This creates pressure against the wall of blood vessel. This is called as blood pressure. Normally, in healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As the people get older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure, one or more close family members with hypertension increases risk of developing the condition. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can also increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty food increases fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one is stress. Reacting to stress is unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That's why it is often called a silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, the early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ear, fatigue, nausea or vomiting. If person is experiencing some of these symptoms, one should get their blood pressure checked. Fortunately, high blood pressure should get their can be easily diagnosed. It is usually measured with an instrument called as sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now, let's try and understand what do this number actually mean. A healthy or normal blood pressure should be lower than 120/80 millimeter of mercury, or it can also read as 120/80 millimeter of mercury. Hence, the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between beats. If blood pressure levels is or more than 140/90 millimeter of mercury, then the person have hypertension. If person have BP levels higher than this, then he or she might at risk of developing serious heart diseases. The risk can be prevented and reduced by taking steps toward a healthier lifestyle, such as regular exercise, healthy diet, quit smoking and regular blood pressure monitoring, stress management, adherence to medicine. If blood pressure is, successfully controlled with such lifestyle modification, then it might avoid, delay, or reduce the need for medication. So let's take a look at the strategies one by one. First, regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel will decrease and lowers the blood pressure. In other case, as we all are aware that the age and weight gain are two major risk factors for high BP. So if blood pressure is at desirable level, that is 120 by 80 millimeter of mercury, then exercise can help prevent it from rising as you age. Regular exercise also helps you to maintain a healthy weight, which is, in my opinion, is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, or swimming, etc. Healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits, and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, one can adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in diet, and limiting alcohol consumption. DASH stands for dietary approach to stop hypertension diet. Eating a DASH diet is rich in whole grain, fruits, vegetables, and a low-fat dairy products, and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure. Reduce sodium in your diet. Even a small reduction in sodium in diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter of mercury. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like read food labels. If possible, choose those sodium alternative of the foods and beverage you normally buy. Eat fewer processed food. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing, so you can eat natural products. Don't add salt. Just one level teaspoon of salt has 2,300 milligram of sodium. Avoid adding salt to food. Use herbs or spices to add flavor to your food. Quit smoking. Stop smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Regular blood pressure monitoring. Regular blood pressure also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High BP level can be reduced by doing regular structured exercise such as brisk walking, jogging, or swimming, etc. Quit smoking and regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctor and check up their blood pressure. Hence, most often I advise patients self-monitoring of their BP levels. Self-monitoring helps person to measure BP at different times throughout the day and over a longer period of time. It also assists doctor to get a more complete picture of person's blood pressure reading at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measures that occur during a clinic visit. Stress management: by learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management technique include exercise, listening to music, focusing on something calm or peaceful, and meditating. Adhere to medicine. A medicine to lower blood pressure may be recommended by doctor if your blood pressure is consistently high, usually at or above 140 by 90 millimeter of mercury. Adherence to medicine is very important as it controls your blood pressure regularly. At least I would like to suggest that there are nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you, everyone.